Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 10th of February 2021. Firstly, numbers. So our COVID positive inpatient numbers, that's those who are within 14 days of their first positive swab, has gone down to 64. Last week it was 96 on this call, and the week before 126, so that's a halving in 2 weeks. That's the lowest number since the end of September, and shows that really it looks as if we've had our second peak in the autumn and our third peak through January, and are now gently but progressively coming down, so we're very encouraged by that. We're still operating 28 critical care beds where our normal capacity is 16, and there are still a lot of poorly patients in those beds who are COVID positive, so we're by no means out of the woods yet. And yesterday we had 8 new diagnoses of COVID coming into the hospital, so although the numbers are down, they're not out, and of course, as I always say, we have to stay vigilant in that space. I'm sorry to say there were 24 deaths reported between today and this time last week, with patients who are within 28 days of a COVID positive swab, and that figure seems to have stayed relatively stable for the last few weeks. In terms of community numbers, the community numbers have also improved a little bit. So in terms of prevalence per 100,000 patients, Blackpool is at 209 compared to 229 last week, Fylde at 202 compared to 272, and Wyre at 194 compared to 241 the week before. What's encouraging actually in those figures is that we're seeing the positivity rate in the over 60s falling quite sharply, and of course we absolutely hope that some of that is to do with the immunisation programme. So that's going well. The hospital has immunised over 14,500 patients and continues to do that, and we've now got teams going up onto the wards to find patients before they go back to care homes and so forth to make sure we've immunised them. Our community teams has been around all of the care homes on the Fylde Coast and is now going back to capture residents who for whatever reason couldn't be immunised the first time around, and the Winter Gardens programme is fully up and running. So the important message about this is, if you are over 70 years of age or are on the shielding list and you have not yet been contacted by your GP practice, now is the time to get in touch and make sure you have an appointment, because we're at that space now where we've got the capacity to catch up on that group and make sure they're fully immunised before the system starts to come down the age groups and the risk groups, which it will continue to do over the coming weeks. One thing I think the Fylde Coast has been good at actually is getting testing done. So we've still got high levels of testing. There is great testing capacity across the Fylde Coast, and it's incredibly important in staying on top of this issue and looking out for the possibility of new variants and so forth, because many of those tests go to central laboratories and are screened for viral variants. So if you have any really flu-like symptoms and you are available to get a test, I'd encourage you to do that, and that of course is done by ringing 119 or going on the NHS Choices or NHS 111 website. Really important to keep on top of the testing so that we know where we are in the situation. So although the numbers look better and continue to improve, we're still seeing new diagnoses every day. We've still got high levels of activity in our intensive care unit. I'm sorry to say we're still seeing people whose lives end in our hospital, and lots of sad stories that come with that. So we're seeing an improvement, but we're by no means out of the woods. We have to stay vigilant, we have to stick to the hands, face, space messages, and keep going, and hope as we move out of this very cold weather and perhaps into something more spring-like, we'll see continuous improvement. Thank you.